Children's surgery is located on the second floor of the Children's Hospital. The waiting room or family lounge is at the front of the hospital. Preoperative area and the PACU is connected in the same open space. The preoperative area includes 17 single occupancy rooms and 1 positive pressure isolation room. The PACU has 10 spaces separated by curtains and 2 negative pressure isolation rooms. The preoperative area and the PACU have their own medication room, but share a common supply room and a set of pediatric and adult code cards. In the preoperative area, there are also 2 induction rooms and 3 procedure rooms. The pediatric OR suite includes 8 pediatric ORs and the sterile core. Additional set of adult and pediatric code cards are located in the pediatric sterile core. The interventional and procedural suite contains the MRI scanner connected to another OR, the interventional and hybrid ORs, and the cardiac catheterization labs. There are also 2 pediatric endoscopy suites. The pediatric and adult OR suites are connected by a hallway and have some common spaces and facilities, which include the OR pharmacy, an additional shared sterile core, the implant room, and sterile processing department. The surgical waiting room is spacious and invites children to explore their senses with interactive art. Monitors in the waiting area allows the OR team to communicate with families during the operations. Patients are prepared for surgery in the preoperative area. The child life specialist is available to meet and support each child on arrival to the pre-op area. There is 1 isolation positive pressure room usually reserved for our BMT or immunocompromised patients. These patients are brought back to the same room to recover after surgery. There are 2 induction rooms where patients can be induced and then transported through the double doors directly into the operating suite. There are 3 procedure rooms equipped with anesthesia cart, computer workstation, and supply cart for such procedures as bone marrow aspirate, lumbar puncture, tunnel line removal, or audiograms under general anesthesia. The pediatric OR suite is accessed by the OR staff through a different entrance than the one for the patients. The OR front desk is where our unit clerk sits. This person has access to all our contact information and call schedules for our surgeons, proceduralists, anesthesiologists, and OR team. Every day, a morning huddle occurs between our E1, charge nurse, and sometimes the PACU charge nurse to plan the day and discuss staffing for E-cases.
All right, so we do a morning huddle here at the front desk with the E1 anesthesia attending and the charge nurse to go over this OR schedule for the day and add-on cases and where we're going to move cases or put cases and make assignments.
We often try and get the pre-op and PACU nurses involved as well because that can be a stop point.
We have 8 dedicated pediatric ORs surrounding a pediatric sterile core. Supplies in the sterile core are categorized by service lines. Each OR has similar equipment and layout. Supply carts carry supplies specific for each surgical specialty in each designated OR. However, any service is able to perform any operation in any of the rooms. Within the pediatric OR suite, there is an MRI scanner that connects to an additional operating room. The MRI scanner has its own induction room and control room. Patients can undergo MRI and then are transported directly to the adjacent OR for their operation. The interventional suite includes the cardiac catheterization lab and 2 interventional radiology rooms. One of the interventional room is an OR hybrid room where ERCP procedures are performed. There are 2 pediatric endoscopy suites. However, endoscopy also can be done in any of the ORs using a portable endoscopy cart. The post-anesthesia care unit, or PACU, consists of 14 beds separated by curtains and 2 negative pressure isolation rooms.